We first numb the toe with an injection at the base of the toe on either side as illustrated here. We then apply a rubber band around the base of the toe to reduce the blood flow during the procedure. Too much blood will negate the chemical used that destroys the nail root. You can see that this nail is very ingrown and thickened and discolored. First, we loosen the nail by going around its borders and underneath it to ensure that she is in fact numb. Why do I know this is a she? Look at the toenails. They're pretty, aren't they? But we loosen the nail up, and in this case, she could feel a little bit that I was doing. It wasn't really painful, but she was nervous, and therefore I elected to inject an additional amount of Novocaine just behind the nail. She could not feel this because she was, for the most part, numb, but we like our patients to be completely numb as we proceed. This blanches the skin white, as you can see here, and does cause a little bit of swelling simply because fluid is being injected into the toe, but this is absorbed by the body and does not create or cause any problems. What it does, however, is ensure the complete anesthetic or anesthesia of the toe. I then again check underneath the toe or toenail to make sure that it is numb, and finding that it is numb, I will now remove the nail. I use an elevator to go underneath the nail, release the nail root, which is at the base of the nail, and remove it. You can see how deeply incurvated this nail is on either side. Now there is some debris underneath the nail here, what's called hyponychium, and this was removed with a tissue nipper. Again, you can see how deeply incurvated the corners are. And this is why she had it removed, because it had been so painful. Here I'm checking to ensure that there is no nail root left or any portion of the nail left. You can see that she continues to bleed a bit even with the tourniquet around the base of the toe. This tourniquet does not put the toe at risk, and she can have this tourniquet on for some time, but we'll have it on a total of less than 10 minutes for the procedure. At this point you see that I am applying a liquid with a Q-tip. The liquid is the chemical that destroys the nail root. It is 89% phenol, and with this technique there is a better than 97% success rate, meaning that you have a less than 3% chance that any portion of the nail will return. Again, you can see that there continues to be some bleeding in the nail bed even with the tourniquet around the base of the toe. You notice that the liquid is clear here and then it turns a darker color. When it comes in contact with blood, it does turn dark and even black in color. We're making sure to get the chemical into the corners, because if any nail returns, generally it is from the nail root area on either side. Here I'm using a smaller Q-tip and application of the chemical to the central portion of the nail root. This is a timed procedure, and one that can be done from a short period of time, especially if someone has decreased circulation, to a longer period of time for a young healthy individual such as this. Now again, she had a great deal of pain with this nail because of how ingrown it was, and she had attempted all forms of conservative care which had been unsuccessful for her. It was painful in her shoes, and with pressure to the nail. She tried trimming the corner out, applying cream to the corners to soften, and other measures without success. I believe she had even had the nail removed previously to allow it to regrow. And anytime this is done, the nail will return the exact same way it was before, unless there is something done to the nail root. As in this case, we're using the chemical to destroy it. But if you just take a nail off, it will come back the same way, if nothing is done other than removal of the nail. Here you can see I have gone to the smaller Q-tips, and I'm using 2 of them to ensure that there is good exposure to the nail matrix or nail root, to ensure that there is a 100% kill of the nail root. Obviously this requires the use of gloves. We also wear jackets and a face shield to prevent any splash, either from the chemical or from blood. This protects us as healthcare workers, and it also protects the patient. The instruments are sterile. They are washed and cleansed after the procedure and sterilized in an autoclave, which is a steam sterilization. Our autoclave is certified once a month to ensure that it is working correctly, and each time we run it with test strips to ensure that it reached the temperature and steam level that it was supposed to, and for the duration of time that it was supposed to kill any type of bacteria. This just helps ensure that the patient does not contract any disease from someone else. The procedure now is finished. The exposure to the chemical has been for the correct amount of time, and now we cleanse with alcohol. The alcohol neutralizes the chemical so it doesn't continue to work, and allows me to clean up the nail bed. You will see there are some portions of irregular skin attached to the nail still, and therefore I will use the tissue nippers to remove that irregular skin prior to application of the dressing. Now the dressing that we use is generally Silvadene cream, which is a very good antibiotic ointment or cream, unless someone is allergic to sulfa, and then we use something different. The dressing we put on is a very bulky dressing, and that is because the toe will tend to bleed more the day of the procedure than after. So the dressing will be more bulky today, but when she removes the dressing tomorrow, she can use a much lighter dressing. In fact, even using just a gauze and a piece of tape to hold it in place. We have patients use a particular iodine-based antibiotic ointment on the toe afterwards, which helps to dry it up quicker. And in some patients we use different types of wound dressings with collagen and other materials. She will be able to drive, to work, to do anything she wants to do, even today, after the procedure. Care is just keeping it clean, washing it daily, but just good hygiene with the antibiotic ointment and gauze dressing. We do follow you up after the surgery at the appropriate time afterwards. This is what a toe looks like once the nail has been removed and it has healed. The dry skin can be kept soft with the application of cream. Now, an infected ingrown toenail can many times have proud flesh, as illustrated here, that grows over the nail itself. This proud flesh must be removed before we can access the nail underneath and remove it as well. Here I'm loosening the proud flesh from the corner, and you will see me remove this, which then allows me to visualize the nail underneath, which will also be removed in the normal manner. Now, oftentimes what is found underneath this nail is again some additional proud flesh that has to be removed, as illustrated later in this video. This void or hole created by the removal of the nail and the proud flesh, once this heals, you cannot tell anything was even done to the nail or to the nail corner. The skin falls back up against the nail and it looks normal.